Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Next, the following are related to bromocriptine therapy except. In bromocriptine therapy, it is used to inhibit inappropriate lactation with secondary amenorrhea. Inappropriate lactation with secondary amenorrhea, yes, you give bromocriptine. It is specific in suppressing only the pancreatic secretions. Yes, because it is a dopamine analog which will block the pancreatic secretion.
Prolactin secretion. It is specific in suppressing only the prolactin secretion. True, because bromocriptine is a dopamine agonist. So it can block the prolactin secretion.
In female, in pregnancy, if pregnancy occurs, there is increased incidence of multiple pregnancies. No, because it has no effect on ovulation. So this is not true. Its teratogenic effect on the fetus is inconclusive. Yes. So this is the false statement. Then we have all of the following according to Ferriman-Galway scoring system. Hirsutism is diagnosed when the score is more than 8, then we diagnose it as hirsutism.
thank you and thank you for watching.